This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us.
Reproductive system.
Part 1.
Hello, my name is Tim, and I want to welcome you to 24/7nursetutors.com. Today, we're going to discuss the reproductive system. Now let's begin with benign uterine tumors. Look at the picture of the uterus on the screen. The uterus is where the fetus develops and is also the cavity from which menstruation can occur. However, sometimes women may grow tumors there. Yes, they're called uterine tumors. There are several types as seen on the screen. Do make yourself familiar with these. NCLEX not really go into detail as to the names of these fibroids, but they do want you to know how they are treated. The good news is most of them are benign, and others may be malignant. Let's discuss benign uterine tumors. The causes of benign uterine tumors is idiopathic. This means the physicians have no idea what causes them. The most common that you probably may have heard your friends talk about are fibroids. Many women complain of really bad menstrual pain with fibroids. What is this called? Yes, dysmenorrhea. Menorrhagia is a heavy menstrual cycle. Some women complain of lower back pain and pelvic pain, while others notice uterine enlargement. The good news is that most of this all disappears after menopause. So what can be done? Well, a hysterectomy or a myomectomy. What does the word ectomy tell you? Yes, something is being taken out. In the case of a hysterectomy, the uterus is removed. Now let's discuss other uterine disorders. Have you ever seen a prolapsed uterus? What did it look like? Well, some students describe it as a piece of round flesh sticking out of the vagina. Others have described it as similar to a bald fleshing head sticking out of the vagina. Whatever it looks like to you, it doesn't sound very good, does it? So what causes this? What causes a prolapsed uterus? Well, there are actually 4 stages of a uterine prolapse. In the early stages, some women are too embarrassed to go see the physician, so when it pops out during a restroom break, they just push it back in. In stage 4, however, it doesn't go back in. Just look at the picture on the screen. It is outside the body permanently. Now you know these women that have big babies back to back like every year. Now, I know someone who had 10 babies every year. Yes, she had a baby every year. Now not because she wanted to, but back in the day the religion she belonged to did not allow contraceptives. Can you guess which religion this was that did not allow contraceptives? Well, what could this lady with 10 big babies have done to prevent a uterine prolapse? Correct. Kegel exercises. What are Kegel exercises? Well, they are exercises that help to strengthen the pelvic floor muscles. How do you do Kegel exercises? Well, while you're in the restroom urinating, we want you to consciously hold or stop the flow of urine. Release, then stop. And release, and stop. We want moms to do this at least for 10 exercises. How many times a day? At least 3 times a day. Yes, that's 10 exercises, 3 times a day, a total of 30 exercises. Now, did you know Kegel exercises are good for both men and women? Yes, Kegels are good for fecal incontinence. It tightens the anal sphincter, and it's also good for stress incontinence. Please tell me what a cystocele is. Well, this is also known as a fallen bladder. Look at the picture on your screen. On the left, notice the normal pelvic anatomy. Can you see the rectum, the uterus, the bladder, and the urethra? Now look at the picture on the right. Notice where the bladder is now. Can you see the prolapse? A cystocele happens when the wall between the bladder and vagina weakens and allows the bladder to droop into the vagina. Many of these women will present with urinary frequency, urgency, retention, or incontinence. Now that we know of a cystocele, what do you think a rectocele is? Right, a rectocele is a posterior prolapse. Look at the picture on your screen. On the left, notice the normal pelvic anatomy. Can you see the rectum, the uterus, the bladder, and the urethra? Now look at the picture on the right. Notice where the rectum is now. Can you see the prolapse? A rectocele is when we see bulging of the posterior wall of the vagina, which is caused by the prolapse of the rectum. Look at the picture on your screen. Imagine if there was a fistula between the rectum and the vagina. What do you think would probably be coming out of the vagina? We have discussed problems with the female genitalia, so let's look at the problems of the male genitalia. What is epispadias or hypospadias? Epispadias and hypospadias are both congenital anomalies of unknown causes. Epispadias is when the urethral orifice is located on the dorsal surface of the penis. Yes, it's on top of the penis. Hypospadias is when the urethral orifice is located on the ventral surface of the penis. Yes, it's under the penis. Now remember, kids who are born with this disorder are not circumcised, as the foreskin is used for corrective surgery. Surgery is usually done at about 16 to 18 months of age. While we are on the topic of the penis, can you see a bit of the scrotum in the picture above? I want to quickly talk about cryptorchidism. It is not in your book, so I will spell it. Cryptorchidism. Now please tell me, what is cryptorchidism? Well, cryptorchidism is when one or both testes fail to descend through the inguinal canal into the scrotal sac. These kids may grow up and have fertility problems. Now class, everyone has heard about priapism, even the little kids. Do you know why? Because it's on TV in broad daylight. They may not know what it means, but they've heard the word. Priapism is a prolonged and painful erection lasting longer than 4 hours. Males with sickle cell disease are at a very high risk for priapism. Other risk factors for priapism include cocaine and quadriplegia. Priapism can be caused by erectile dysfunction drugs such as sildenafil, tadalafil, and vardenafil. These medications are contraindicated in a client who is on nitrates, nitroprusside, or B blockers. I repeat, sildenafil, tadalafil, and vardenafil are contraindicated in a client who is on nitrates, nitroprusside, or B blockers. Please write that down. In the hospital, priapism is treated by draining blood from the penis and giving the client medicines to restrict blood to the penis, like phenylephrine. One day I was teaching about priapism in class. One of my students jumped up and in front of the whole class said, "I want to share my experience with priapism." And can you guess what the ladies in the class were doing? They were giggling. He had taken Viagra and went to be with his wife. He had priapism and refused to go to the hospital. Can you guess why? Well, he was embarrassed. Do you know ischemic priapism is a medical emergency? Class, please remember, when you are caring with patients, think about how they feel. When you have to help people in the restroom, remember they are probably very embarrassed. Cover them up. Treat them how you would want to be treated. This is what makes us excellent nurses. This is what makes us one of the best professions in the world. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.